Hi, this is pharmacist Curtis Alexander. Today's video we're going to touch on Ampyra or dalfampridine. Before we hop into it, give me a thumbs up, subscribe to the channel if you want to see more videos like this. So Ampyra is a multiple sclerosis drug, and from here on out I'm just going to call it MS because multiple sclerosis is a tongue twister. So uses, it's used in MS patients to improve walking ability basically. As MS progresses, that movement patterns become very difficult for some people. So really, rather than treating MS, Ampyra is designed to improve the walking ability of people with MS. So how it does that is it will actually go in and it blocks potassium channels, and that sounds maybe bad in a way, but the end result is when these potassium channels are blocked, what we see is an improved ability for the neurons to conduct. And when that happens, we see a strengthening of the skeletal muscle, the fibers, and their ability to twitch and to move. So we can see some improvement in the walking ability with Ampyra. Now, how is it dosed? It's an oral medication that's taken once every 12 hours. So not the most convenient thing, but when you have something like MS, it's most of the times well worth it. Now, it can be taken with or without food. That's not really critical, but what we do know is that if it's not working for someone, if they get a little benefit and want to get more, there's really no benefit to bumping the dose up. So in a way, you kind of know if the 10 milligrams every 12 hours is not working, increasing the dose is not going to benefit at this point. Now, it does come with a side effect profile. It's not bad, but there are some things to keep an eye out for. The most common, people can get urinary tract infections with it. Again, in this case, in studies, it was up to 12%. I like to stress this in every video, is that because I put 12% there doesn't mean 12 out of 100 people are definitely going to get it. It's just we see it up to that point. Insomnia and around 9%, dizziness around 7%, HA is headache around 7%, nausea around 7%. So again, not super bad profile, but these are things that can happen. What you really want to watch out for is if you have any sort of seizure disorder. And that's because early on, within the first days to weeks of starting Ampyra, you can see seizures happen. If that happens, the drug has to be stopped. It can't be continued. So if you have a history of seizures, if you're at a higher risk for seizures, if you have a history of them, can't do it. Ampyra is what we call contraindicated in that case. If you have a risk factor for it, that's something to discuss with your doctor, but something to keep an eye out for. If it does happen, you have to stop taking it. The other thing is we want to watch kidney function. It's broken down that way. Blood levels can be increased and can increase seizure risk as well. So really important point there. I always touch on hair loss, weight gain in all the videos because invariably people ask. It doesn't appear to be an issue with Ampyra. Again, if you look back, some of the side effects can be headache, nausea, dizziness, not something that's going to increase your appetite per se or make you necessarily gain weight. So maybe even the opposite, some weight loss. But important thing here is monitoring. We already talked about the kidney function. If you're not familiar, what they're most likely going to measure is what's called your creatinine clearance. And anytime that drops below 50, Ampyra would not be a good choice. So they will monitor your kidney function, might do an EEG. The other thing that we have to do a lot on these folks is most insurances, whether it's right or wrong, good or bad, they are going to require a timed walk. So they will have the doctor in a 25-foot, they'll have the patient walk 25 feet, and they want to see improvement in the walking ability. Again, that's why we're using the Ampyra. So they want to make sure it's working before they're going to pay for it again. So that's going to be a requirement, something that you need to know going in, that's going to be required of you to go in and do that walking test for most insurances. So again, so Ampyra, any questions, post them in the comments. I will do my best to answer. I appreciate you watching. And again, Curtis Alexander, until the next video, thank you.